Mo abro e kwinference ge sonyala anyi na nketa ka anyi no lia ko no makwale ife anyi ji we bia.
Muabu Uchechukwu Ebonam Ugo Ebenaja Wenasuno Ndebanye Biano Kaino Ledikaisa Nolinambu na Nzuko Anambra na radio. Tata na radio oga masim obulu na inwere ifu ibupo smartphone. Obulu inwe smartphone inokwa na Facebook. Kega na Facebook anyi bo Anambra Broadcasting Service. Ega na nya bo Anambra Broadcasting Service. Iga afu ebanyi no live. Ki sunyere anyi. Makana isiokwu anyi jina kano tutua. The issue hygiene is something that needs you to watch. So obuna inwere a smartphone, I would advise you to watch this morning and listen. Inwere a smartphone, listen very attentively. If it's possible, if you're not akoko ekwentigi with your pen and your paper, maka ihige dede kanko. Tata na Nzuko Anambra, the platform where we discuss issues that matter to our health, society, and development. Today we'll be looking into a very important aspect of our well-being, which is oral hygiene. Oral health goes beyond having white teeth. It affects our confidence, speech, nutrition, and even our overall health. Poor oral hygiene has been linked to serious health conditions, which we'll dive into later in this show. So today, we want you to learn more about how we can take care of our mouth, our teeth, our gum, aneurysm. And importance of oral hygiene. Bo dental therapist Onzulibo Neka Ijoma Nyabuzwa secretary in the Nigerian Dental Therapists Association Anambra State Chapter Munye Ndioka and Asia no na Nzuko Anambra nototua.
Thank you. Good morning for having me. India Anambra, thank you for having me also.
You're welcome.
Thank you.
We also have a core member, dental therapist, Rasak Sakurudin Akombi. I hope I got it right.
Yes,
okay, so you're welcome to Nzuko Anambra.
Okay, good morning, everybody. Thank you for having me here too.
Okay, so for a start, let's know what oral hygiene is all about.
Okay. Good morning once again. Ima. Okay. Okay. When you talk about oral hygiene, yes, you're talking about human being having a good oral health. Not just all about oral health being clean. When the person talk, you see it's clean as you said, no. But it has to do with how do you maintain that your oral hygiene? How do you brush? What you eat? How do you make sure that what you're using to brush is very okay after you're brushing, or how do you keep it? That's first of all what you talk about oral hygiene. And another thing is, have you ever been to a dentist for your oral health care? Where you talk about, it says maybe it's doing your scaling and polishing. And when you talk about doing such a thing, you then talk about your oral hygiene. Is it okay? If it's okay, it then depends on us to ascertain and certify such.
What are things that people should do to have good oral hygiene? Steps people should take to have good oral hygiene.
First of all, before you talk about things you should do to have a good oral hygiene, number one, you talk about your toothbrush. Okay. Yes. Do you have a toothbrush? If you're using chewing stick, do you use it very well?
Chewing stick?
Yes.
Is it advisable to use chewing stick?
Yes.
I thought people said it spoils our gum.
No, because the way you brush actually determines it. When you don't do it the right way, it destroys your gum. Even the toothbrush.
Yeah,
yes. Even the toothbrush I use, we use your former, it also destroys your gum.
Okay.
Maybe let's know the right way to use it. Kuziela, that's why you're here.
Okay.
I'm Malamakomo, you can mother so who will name made the blunder.
Jekwa ne na Facebook.
Back in the days, Abia in the school, that you said this is the way I brush my teeth, brush my teeth, brush my teeth. But it's not the ideal thing to do. Because each wear this toothbrush, the chewing stick, you also do the same thing at the room.
Yeah, you got left and right.
Yes, if you too. If on them they chairs, they close up their teeth like this and be doing like this. No, it is not. You open it at 45 degrees and you take from a stroke to down. This is how to.
Up and down.
From the gum to the teeth, not up and down.
Okay.
From the gum to the teeth, from up to down. This is Kigeshina says, and mind you, you open a little. So that whatever you get from here, you dump it in here. Not in the sense the image when you're brushing, you're doing it this way. After everything, here are you okay, here are you okay. You understand? So you do this from here, you brush, you go to this end. The same thing, you come inside, you brush out again. You don't brush it like this. You sweep way out. You're massaging your gum and also you're removing any food particles so the in between your two teeth, interproximal, because each area like this, you find out that the food particles ends into the interproximals. Gap between another teeth. After everything, you continue to have dental problem and you find out so you tell the person you massage from your gum to the teeth.
Wow.
This is how you brush out. You brush it down. The same way you sweep it out here. When you come inside, where your tongue, you find out that when you move, your tongue should move. When you put your brush, you sweep it up. It's an the same way you sweep it out here. When you're doing this the right way, you now massage your gum and also brushing your teeth very well. Yes. But when you do it like this, you lacerate your gum. It now causes that problem on your gum and thereby not brushing very well. So we advise you brush up from the gum to the teeth. From the gum to the teeth.
Yeah,
Go better. Boss, we may be and never go belly and there be you can do it a circular motion or you brush it straight. After everything, please, your tongue out. Yes. And after doing that, your brush, please, after doing it, emphasize you wash out the particles left in your brush. And you keep your brush straight. Yes. Some people after brushing, no. Some people, as such as you find out they go back to cap their toothbrush. No, cap is actually if you're on a traveling to somewhere, you have to go. Yes, you cover it so that it's in your nima body. It will not either us the women neighbor to or dolo hair.
Okay.
Yes. So that is the essence of that cap. And after everything, such as after rinsing up, please, yes, go dry. And when you keep it so, ina phone a brush, you know, nata ochicha mo here na
brush.
Yes, if the toothpaste says that you did not wash out your brush very well. So we advise you use a warm water to rinse it out before you brush again.
So, ndine do one brush na toilet. Intacha to have a brush in a toilet.
It's not good. Aduroma, because while you're flushing your toilet, microorganisms behind the afwanya. It tends to perch on this toothbrush.
Wow.
And you still apply it in your mouth. Thereby, ibutenezi, and this our mouth is the gateway to our body. Your body ibute. You can report on at that time. You do report to 1 hour. without you knowing. So, I'm one going on. In a building, in a toothbrush in my bedroom. Because from today, make a space in your room. Yet I go hang your toothbrush outside your toilet. Because
Okay, to you, Koba, what challenges do you observe among young people when it comes to oral hygiene?
Well, good morning, everybody, once again. Because I see the young one, they think oral health is just something about doing tooth whitening, that, okay, doing all these aesthetic
Braces.
purpose, all these braces. The oral health is more than that. Because the oral health in our body, our oral health is playing a vital role the way our other systemic health are playing the vital role as well. But some people think that our mouth is just separate for our body. Not lie. Because the same nerve and the same blood that is passing through our body is passing through our oral health as well. And you see all our young boys, some people, they do smoke, take alcohol, they take all those things. With still, they will not take care of their oral health. I hope I hearing me now.
Yeah.
And some of them, they will take all these chocolates and all those things instead of them to floss, to rinse their mouth after taking all those things. Still, they will still do something that we call adamant. They will not do it. They will still eat like that. Now why you see us, now why you see all these our young people suffering for toothache and other tooth problem.
Because
Okay.
after
Because they
chewing
neglect,
sugary
yes, and
things,
because they neglect their oral health the way they're supposed to take care of it.
well, we've seen images of babies who suckle. Does it have anything to do with the final formation of the baby's tooth?
yes.
Okay, thumb sucking.
Yes.
Okay, thumb sucking is not good. You see some people that have something that we call overjet and overbite. You see some teeth will be like this. Our teeth supposed to align. See my own teeth. It's supposed to align like this. But you will see some people, due to their thumb sucking and their thumb thrusting, you see their teeth will be like this.
Uh-oh.
Have you across some people like that before?
Yeah, why not?
And then you see some people, their teeth will be like this, due to neglection of that
Parents.
procedure that's supposed to follow by their parents that time, but they refuse to follow it. So that's the reason why you see, as a result of, you see some people, their teeth will be like this. They will be looking for a lot of money to do the braces to correct that problem.
Okay.
Okay.
So what are the importance of oral hygiene? Let's know that.
Okay. Okay, the normal thing.
Go ahead. Okay.
Importance of
Okay.
oral hygiene in their normal thinking is for you to have for you to have a complete
When you take who will know a bit, so people
Okay.
can hear you.
for you to have a complete health. Yes. Because now oral hygiene is a you have what we call halitosis. Yes, onwishi. So nobody na imero that important thing the importance of oral hygiene and adure. So your dimpanina says to avoid halitosis, and also you come to dental for what we call scaling and polishing. Okay? Yes.
Mana when the na says mana how can we halitosis ano onish? Is that when we hold the hand metaphor? Or does it boil down to the way it has atadiatu?
Yes. One, it boils down to the way we say atadiatu. Two, we refer the person to go and check, to go to his or her physician to check the systemic side
Yes.
of it. Because imana ebiaha and say yes, oral health. Na onya neshish. Sometimes people come to us, my mouth is smelly. We tell the person, let's check your saliva. We know the smell of the saliva. And when we perceive it is not smell of the saliva, that's when we ask the person, in a ulcer, in a cardio problem, in the diabetic, there's some certain things when we ask, we narrow it down to where your problem is coming from. We now refer you for treatment.
So most of the time, onoma the jeshish or boro no nyahana hatata ofuma. Working with underlying issues.
That's the reason why we have that causes of that bad breath, that is halitosis. Normally we have something that we call systemic disease. We have the one that we call systemic, and then we have the one that we call psychological, and then the one that we just come by all this normal food that we eat, like eating all this garlic, all those
ginger.
things. But systemic disease, the systemic one is like maybe someone have something like maybe you have HIV or diabetes and all those things. So that thing can also lead to, or ulcer as well. So that thing can also trigger your oral. It can also trigger that halitosis. And then the one I call in the one I say that is a psychology. Some people think that my mouth is smelling. With their mouth is not smelling because they have that thing in their brain already that their mouth is smelling. So that's the reason why sometimes we invite them to go and see their physician to cancel them on that.
Wow.
Okay, we have to open up the phone line so that people can join us. Line is 0706 5381 320. And if you're watching us live on Facebook, drop your comment in the comment section. Agopotakuya.
Mobo isere anyị ozi na Facebook na Anambra Broadcasting Service dịka ị na-esonyere anyị. Drop your comments, your name and your location as well. Anyị ma na phone the right way to brush. Onye gecha radio tata we gonna brush kwa in that format in our brush before. Imani in never knee. Well, aside from using toothbrush and toothpaste, we've seen people use salt water, charcoal, and other practices. These methods, are they harmful or are they effective, in keeping your oral health in a good state?
Okay, before you answer, somebody's here. Hello? Hello?
Good morning.
Your name and location. Please go ahead and respond to the question.
Using charcoal, salt water, and all that in place of toothbrushes and toothpaste.
It's not good.
Okay.
They say charcoal makes your teeth whiter, and yeah.
In my hair.
That's what some people say.
In my hair. Back in the days, charcoal is being used.
Unye.
Yes.
Still
Because
method.
I lot of more and sometimes as I know much our mom will tell us they will do charcoal. Where charcoal with their chicken and zega. Yes. And trending now and we go charcoal toothpaste.
Yes.
So charcoal is good to brush, but salt I do good to brush with. Because salt how will I say it is a sodium chloride, and when you are applying it on your gum, you find out you will not notice, but us would know that you're having tiny particles of your gum leaving you gradually. Yes, because that salt is very hard. Think about it when you taste salty food, what happens to your tongue. So that is how it also burns your gum.
Wow.
Yes, but rather we recommend you, if you go for dental treatments, even scaling and polishing, such as we recommend you do warm water and salt. Why do you do so? Because salt inhibits microbes from coming in. So when you do that warm water, diluted, warm, and volume of salt we will tell you to use. When you do so, you find out that healing comes in faster, because now if you check the air in this place, it's contaminated. But with you as our patient on warm water and salt, you find out that those bacteria will not come in.
Okay.
You understand? The environment is clean to help you get your healing fast. So we don't advise salt to brush, please.
No, charcoal is okay.
Charcoal is okay.
Not this.
Not sometimes I recommend patient do your home own charcoal, mix it with paste with fluoride.
Yes, it's not ordinary charcoal. It must contain something that we call fluoride, because now that fluoride it fights against any bacteria in our mouth. Any toothpaste without fluoride is nothing.
So how do we even identify good toothpaste?
Okay. Okay, normally if you go to any supermarket or pharmacy that you want to buy, sometimes I do tell people that if you want to buy a toothpaste, better go to dental clinic to go and get it. Because those people, they know the one that is suitable for your own teeth, and then the one that is suitable for your own net as well. So that is it. Because some people, you just say, okay, I bought this toothpaste now. Since I bought this toothpaste, since I've been using this toothpaste like this, I see different things on my teeth, different things on my mouth. Due to what? Some people, they think that, okay, using of that toothpaste, the toothpaste that you're supposed to use for 3 months or 4 months, some people use this for a week.
Why? How?
The leak, huh?
Yes. And then the excess of toothpaste in our mouth is not good. Well, because something dental fluorosis, you see some people, their teeth will be white, and you will see all these small patches in their mouth.
Yeah.
Not due to anything, it's due to excess of that fluoride and excess of that toothpaste that.
But at least if you want to use it, it will cover the brush at least.
No.
Oh.
A bin shape.
People like say you follow for people where they cover that.
No, I'm just asking.
You
we want to know. We're here to learn,
It's a bin shape. Small shape like this. A bin.
Also garlic granite size.
Okay, size the granite.
Water is the granite size.
Yes.
It's okay. It's okay.
Will it be enough to?
Yes.
You imagine.
You don't need much paste to do your job. It's actually the brush that does the job.
Okay.
Yes, it's the brush that does the job. And I find out more when I tell my patient them, you eat the paste that if you put it in your mouth, use your tongue and rub it around. Wait for some time before you use it to brush. Yes. And after brushing, because it for left particles and digging on. Sometimes depending on the patient case, I tell them not to gargle.
Okay.
Yes. Because when you don't gargle, a patient has sensitivity. Like he was saying, when you come to us, the dental, we now ask you your age, find out your problem, and we recommend a good paste for you.
Okay.
Because and the kind of food we eat now, we find out that more sensitivities are on ground. More gum recessions are on ground. But you find out that people never use paste that. Or say you know demand, you run and go and use it. If after everything you're not getting that good thing.
Wow.
Most paste now, I say you want a powder, not called name powder then after.
I'm a maybe in Nigeria, man. I'm here. On your will.
That powder then after, it doesn't contain fluoride. The most ingredients, and mind you that this fluoride, without anything fluoride on the teeth, it won't be house anako. And Ima, obodo even they wanted their own fluoride, even in their water. But get the water and you want fluoride. So only that toothpaste and the food that you behave that fluoride. So that is why we tell you, use granite size after brushing. Don't gargle out. Spit out, and you go where you're going. Wash out your brush and you keep it safe.
Wow.
Yeah. Oh, and then I so I need to make cut when you were educating us. So call in now 0706 5381 320. Drop your comment in the comment section on Facebook. I go Patakuya. We're going Batan. Hello. 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 Because actually, network issue.
All right. How often should one visit a dentist or a dental therapist for checkup? How often?
Okay. Normally, it's every 6 months. But some people will have something that we call, like all these our geriatric patients, that is adult patients, all these old people. Yes, all these old people. I do recommend every 2 3 months for them.
Okay.
Because those ones cannot stay a long time on dental chair. So those people that is like youth like me and another age as well, that you know that okay, this person is healthy. So this person can stay for the long period of time. It's every 6 months. And also, if you have another appointment, so you can call. But for the normal range, it's every 6 months.
Okay.
Wow.
Then, how many times the hygienic I brush our teeth daily. Even is it good before eating or after eating when you wake up in the morning?
Okay. So many people need debates on that.
Okay.
But health-wise, you brush 2 times in a day.
Okay.
Itetola n'ụtụtụ, I believe na-esa leze n'abalị. 1 million ụtụtụ, which is good for your health. You eat, you brush. Very, very important, that morning brushing, because obolo like no phone ki idaba into in the morning. Ilisia do phone and mind you need brush you go. Now tutu ahụ.
Okay.
Wee liwe ofe onugbu ahụ, ilisizi ofe onugbu. The veggies in your ofe onugbu tends to remain in your mouth.
Yeah.
And when you come out to talk to people, in my peers, I say, watch the veggie in your mouth. You understand? So, and another thing is the oil or something remaining on your mouth will also make you not to have a good aesthetic day. Because when you talk, people tends to hold up their nose. You keep wondering,
Yeah.
yes. So it has been researched and proven that you brush after your breakfast. It says all those food particles left in your mouth.
There are people that are saying that the research says I'm trying to understand why I should brush after my breakfast.
Okay.
Why? I think, is it not brushing before eating?
Okay.
It's not
Why
brushing.
should I brush after eating breakfast?
Because that's the reason why we say we
You
should
have
be
food
brushing.
particles.
Okay.
You have food particles left in your mouth.
So I can't eat and brush again?
Well, you're wasting your paste. If you wish to do so, you do so. But after everything, you find out that what you should have done last night, you did not do it maybe, or what you should have done after.
Okay, the ideal is to brush before going to bed?
Yes.
Okay.
And then before going to bed,
Last thing at night.
and after your breakfast.
Breakfast. Okay, we have a message on Facebook from Matthew Anambra. It said, Akama from Northia, chewing stick. Is it not relevant nowadays? Chewing stick.
Okay, yes, naturalistic is even fun nowadays, but Makwala man some nutrients, the naturalistic.
And the way we train it.
They quite good to our body. And mind you that it's not just eat what naturalistic, you chew it to be moisture. It turn out this soft. Yes. It layer of more. If you chew it very well, you use it to brush your teeth. And also the minerals in the naturalistic helps also in your
It's medicine also.
Is there any question on IG?
No. I remember very well. The Yorubas have
We have
sticks.
Pako. Yes, we have Pako, Oriyemi Gbegiri, all those one in Yoruba. We have that, all this cashier. So all those things. It's medicine as well. So we can use it, all those one. But if you want to use it, you need to tune it well to salt before using it. Before, if you not tune it to the normal salty, if you want to use it, that thing can wound your gum as well.
I want bundi Igbo like dogoyaro, gova, oshishi gova. For quite some people, they use oshishi onubu, bitter leaf to chew. Those minerals, that bitter content of it, helps also in the body and also in your gum.
Okay, we're going back to I connect. Hello. Hello.
All right, we have a message on Facebook from Prozi Ozioma. Ose, Omo, I really want to go for checkup.
The combo.
Can you explain the attitude of our people towards going to visit dental clinics? Do we have a good number of people, knowing the importance of going to the dental clinics to check up on themselves?
Okay, can I number 2 before is hello. Hello. It's not working. So please talk to us. React to that one.
Okay, the turn up for dental is, I won't say because I can't rate it for now, but normal. only when they visit us, the dentists, when they've done all their home care remedies or work, and when they now come to us, there is I had to really to what we call extraction. He will put the eze, mobuneze, or no gum, neneko hands, we do what we call scaling and polishing and gum treatment. Yes, if you have no feeling, we do the feeling aspect of it, and the patient will go. But one thing I know that is very important, for people to turn up more in Ghana dental centers is because in Nigeria in general, everybody believes in the teaching hospitals. You understand? The general hospitals, nobody tends to visit.
Yes.
When it has to do with dental, it's only the antenatal people knows general hospital. The PSC, nobody knows dental there. But if the dental therapists are licensed to be at those checkpoints, if they are being posted and set up at those centers, awareness of dental will be so much, because a PH center will map out days they will go for oral dental, and the dental clinic will now be close to the people around that area. Even in a village, in a community like Umudioka, Amenia and all this, they have a health centers there, but they don't have a dental units there. It's only in our mark where we work. So when you see patients, before cheche, ijeba mark, home remedy. But what will help us to have more dental people come to us, not only for ibe wopweze, but isakweza sa ibe dental checkup is where we have us in the primary, secondary, and come to tertiary.
Okay, when to take or even decay, and how can we eschew that or avoid that?
My cavity, the calux in the junese.
Okay.
Calculus. Yes, calculus. Olopo.
Okay. There is adage that say prevention is better than cure. Okay, normally we are saying something about scaling and policing since morning. That is the cleaning of the mouth. Reason why that we are hammering on that one is that if you come for your scaling and polishing, and we notice that okay, these teeth or these tooth are small hole, and that small hole around that time we can feel it before leading to removing. But some people just think like that teeth is not paining me, I don't need to go. Until that it will now starting giving them problem, they will now come to dental clinic. That cleaning that you refuse to do, you first do that one first before removing that your teeth for you. Yes.
Wow. Okay. Add the one. Okay,
repeat what you said.
How people their gum and cow
depend on cost to take or decay or whatever.
Yeah, na cost.
And if I name to prevent it.
Okay. Yeah, na cost what is toothache issue. That's cavity, hole nese is first of all Ada says yes, because food we eat these days has a lot of sugary things on it, and when that sugary things deposit on that tooth, the bacteria the that one or make it a patch that food particle or money go and in the essence of eating up that sugary particles, let's say chocolate, that they want actually in the essence of the bacteria eating up that chocolate, after the whole thing, as the bacteria is eating up the chocolate, on a deposit on the car, how they used to say it, EGG ne limi, on a deposit maggot.
Yes.
Thank you. As the bacteria is eating up that it's depositing acid. And that acid is what is breaking that tooth. Yetago acid and how deposit acid down on that tooth did sit and they was weak. Because na here abakutegia. Or this year weak, always ikiji tie or anything. or drop, or there's a drop. Say, no can be no accumulation of live for long, those acidic, sugary things that you were not taking care of that caused that problem.
Oh, okay.
You find the solution to that now.
So when you notice such, if you notice it on time, your oral health when you notice such, you come to the dental.
Okay.
Yes. When you come to the dental, we examining you. If you're early enough, it will lead to filling. But if you're late a little, it might lead to extraction.
Wow.
Yes. And also, in some cases, modern now, it might not only be extraction option. There's what we call root canal. It's a henene the environment. For now, here me kwa na emego, but no way ka ga-esi menwe. What is the dentist to check? Onene ha ni often I get me you tell you I get me what we call root canal. Let me tell the root canal, the tooth is still saved.
Okay.
God, I beg you. We have messages on Facebook. Proxy Ozioma, please, is dental floss good or toothpick?
Okay.
Okay. Luckily, Floxy, I'm here with the dental flux.
Okay.
If it's not good, I won't be here with it.
Okay.
I'm not here with toothpick. Toothpick, they use it only to pick meat.
Yes.
Yes.
Yeah, that was a toothpick.
Our buying a toothpick. Research. Our buying a toothpick. This is dental flux. Here, GMA. Yola, show them what you use.
Okay, this is dental floss, right? The dental floss, and some people they are misusing this dental floss as well. You see, this is dental floss, and this is like something like rubber on his mouth. So we are using this one to remove all the interdental, any food that are chatting between our teeth, not this sharpening area.
Nobody toothpick side with that.
Yes, that's the reason why we recommend that toothpick is not good. The reason why we say toothpick is not good, the way we use that toothpick to pick something out in our teeth, there is something that we call a periodontal pocket. There is something that we call, you see, between our teeth like this, there is a gum and the teeth. You see this place like this, they attach together. But as we are using the toothpick, you are using that thing to create a hole here, and that thing can lead to another problem as well. So if you want to use toothpick, see, if you want to use dental flux, see the way I hold it. You see something here like this. You see, if anything is here, see me.
To come off from.
Yes, and some people.
Interproximal.
Yes.
Interproximal. You use your dental flux there. The toothpick, the size of toothpick is not meant for your teeth. When you push in that the toothpick, that wooden toothpick, it can break inside. And also, in a push here, your gum that is held is what you are affecting.
Wow.
That weight of that toothpick tends to expand the gum between the teeth. Oh yeah, some people will now come down with what we call dental pocket.
Yeah.
Yes. And when the pocket now in between the two teeth, which pains more than the tooth problem, because now it has that pocket.
Yeah.
Yes. This nkiyineku that looks like pig here is advisable. You can use it because it's shaped into our interproximal. It can go in, and you can use it to remove foods from on your pits and fissures. Nifo, nenu. You find out ita guava, mpulu guava, kacha afadana.
Yes.
Molars, pits and fissures. Yeah. So man, we wear dental flux. Wear this kind of dental. The end sharp end, you use it to pick it out. That.
So, on the dental association, why wouldn't you allow the use of toothpick if it's not good?
Importation of it.
So,
okay.
Regulate.
We create that awareness by I dash out flocks to people and advertise.
At least I will get one pack this morning.
Yes, for sure, by His grace.
Mana kedu ka ga-esi mezi ndị bicha n'ime obodo na-ewere ego floss anyị ejinweriri akwa like thread
Hygienic of that thread known to me. But in some cases, I know that some people use it.
Thread.
Yes. So it's better you can use thread than people say that they use umpilaziza.
Yeah.
For the they use umpilaziza.
Yes.
Afacheze. When they use needle leja doakwa. Afacheze. Mind you, now that needle leja doakwa is a sharp object. Imaro onye ji we do ihe. Enwe ike ka ị na onye a na-adụ ọdụpụlụ anụ aria. Yetago and blood are down one. Yes. Blood are down one. So onya do doesn't need to je will do. Iduta you start causing problem and even get contaminated.
All right, we are time and Gago. We'll have a couple of messages to do. Hey guys, good morning. Please, how do we truly have pace? For toothache. Okay, do we truly have paste for toothache? Just give us a yes or no.
Yes or no toothache, baby. I not forget that. The dental will tell you that.
All right, and then proxy.
Another thing we want to talk about is spa teeth whitening.
Just in a few seconds. We no longer have time.
This teeth whitening, because I spa centers to do. It's not professional because. Go to the dental center, you get a teeth whitening, and we'll know if your teeth is healthy for teeth whitening.
Voila.
Yes, Biko.
Okay. All right, thank you so much. Dental therapist Onwuzunigbo Neka Ijoma from the Chukwemeka Odumegwu Ojukwu University Teaching Hospital, Amako, and Secretary NDTA Anambra State Chapter Dalo for coming on Nzuko Anambra this morning.
Thank you for having me in the Anambra.
And then Rasak Shakirudina Kombi, I need to rehearse this your name very well before pronouncing it. Then two therapists, and of course a core member from COYUTH, PPA. You're welcome. We want to thank you for coming.
In the Anambra, thank you.
Voila.
So since you're here, you've not learned any Igbo. Okay.
I don't learn Igbo.
Greet them in Igbo. Ndewo nda Anambra.
In the Anambra.
Ndewo.
Ndewo.
Ndewo. Yes, that is. Thank you very much.
Okay, Ndewo Anambra.
You're welcome.
Thank you so much.
Yeah, I am Roy Egunife. Thanking you for joining us on today's Nzuko Anambra.
And I am Uche Chukwu Ebonam Ugo Evenaja. Visit your dentist today. Someone is asking me when are we doing free dental checkup. Visit your dentist, Prozi.